hand versus chainsaw. It looks painful.
Our hospitals are taking care of more patients than ever.
You're right.
With medical teams under constant pressure.
Can Dr. Pixie come to resource, please?
Somebody as poorly as this little one, we really need to treat them quickly.
To meet our expectations.
I'm just worried about what it's going to be like afterwards.
But there's a crucial member of the team we sometimes forget.
I've never ever been on a bed like this.
The hospital bed.
Another ward, another storage, another bed.
In our lifetime, we are likely to need one of them at least 3 times.
I've probably spent a quarter of my life on a hospital bed.
In this series, our cameras have been given unprecedented access to beds in 4 very different hospitals across the country.
It's life and death and everything that goes in between.
We'll see the world through the bed's eyes.
Hello, my love. Hiya.
As they share the most challenging.
I don't know what to do. I don't know.
Most intimate.
Okay.
And most rewarding.
Happy birthday. In the hospital, wonderful.
Moments of our lives.
Thank you for being here.
Have you been anywhere else?
And a hospital cannot function without beds. Beds are vital.
This is The Secret Life of the Hospital Bed. At Newcastle's Royal Victoria Infirmary, A&E is unusually quiet. The department sometimes sees more than 400 patients a day. It's rare for the unit's 29 beds to get a break. Nurse Griffiths has been part of the emergency team for over a year.
Never ever say the Q word. It begins with a Q and it rhymes with riot. And we never ever say it, ever. Anywhere. It's worse than swear words. It's worse than anything. It's a jinx. Never ever say the Q word. It all falls apart when you say the Q word.
Emergency Department RVI.
It's 12:20 p.m. and things are about to change.
Yeah. It's a query meningitis, young chap, 18-year-old. Rash and cold limbs, and tachycardic. So it's 5 minutes.
Monitor no recess. Temperature's fine, BM's fine.
18-year-old George, a fresher at Northumbria University, is brought in by ambulance with suspected meningitis. He's taken straight to A&E bed 15 in an emergency monitoring bay.
So we're just going to pull this curtain around and get you on our monitor, okay? How you feeling at the moment?
Pretty rough, to be fair. The worst I felt probably, and well, yeah, the worst I felt.
George's GP suspects he could have meningitis, a potentially deadly bug which needs to be treated immediately.
Okay. You've been unwell for a few days then?
Yeah. I got a headache, been sick a couple of times, went to the doctors and they found a rash on my foot, so check if it's not meningitis.
Before the GP sent George to A&E, he injected him with potentially life-saving antibiotics. Meningitis can strike very quickly and, if untreated, can kill within hours. Student nurse Daly is helping with his care.
His obs were very high, his heartbeat was high, and he had really low blood pressure, so we brought him in to monitor him straight away.
That tap is a little folded over. Sorry. I'll send these bloods off, okay.
George only left home for the first time 3 weeks ago.
What are you doing if you're living in Nottingham?
IT management for business.
Oh, are you?
Yeah.
Very good. Are you in freshers this week?
No, it was a couple of weeks ago, I think.
Oh, was it?
A week ago, yeah.
He's not from here, so we're just like keeping a chat on him because his family aren't nearby. If I had to go into hospital myself, I'm not from here, it'd be awful, so you just you have to rely on the nurses to, like, you're putting all their trust in them. So, but his parents have been called, so hopefully they'll be here soon to be with him.
Doctors will monitor George's condition carefully. If he has meningitis, he could deteriorate fast. The NHS spends over £2 billion a year on smoking-related diseases. The North East is the region with the most smokers in the UK. Smoking is the main cause of preventable illness and premature death in the UK.
Today, it's a 3-hour wait.
Yeah.
I don't know what the bed situation is.
At Newcastle's RVI A&E bed 9 is being cleaned down, ready for its next patient. 24-year-old Josh, who is a smoker, has arrived with his 26-year-old fiancée Emma.
When I breathe, I have this like burning pain in like my chestal area. It feels like someone's stabbing me, to be totally honest with you. It's quite worrying because when I went to see the nurse on Friday, she didn't know what was causing it.
He's had a few like chest pains before when they've been young. Don't want to be too serious.
The main smoking-related illnesses include lung cancer, heart disease and respiratory diseases. Josh has been smoking 10 cigarettes a day since the age of 13.
A lot of the time recently, because of Pokemon Go, I've been walking a lot more, and I think that I've been walking a bit too much and I've been pushing myself a bit too much.
Josh and Emma met online through their mutual love of gaming.
Well, first of all, I couldn't stand you. You were annoying, you were obnoxious. And then we started talking and discussed hobbies. And then 6 months down the line, you came up here.
Yeah, the first time I took her on a date, I took her to a Greg's.
Greg's?
Yeah.
Cheap and easy?
Yeah.
That's where he took me the first time I went for food. He said, "Oh, you're hungry?" Then went to Greg's. I was like, okay.
Josh and Emma are planning to get married in 2 years' time.
It's my engagement ring, yeah. Got it perfect.
Just wait till you see a wedding ring. So, we went to Peterborough, where I grew up, in the town centre.
Water fountains.
Yeah, they come up on certain times. I bought some roses, turned around, watched it to see how long it would last, got on one knee, and then the water came up as I said, "Will you marry me?"
Which was nice. I mean, how could I not say it? Like, say yes to that? Why wouldn't I? It's like perfect.
Josh was admitted to A&E bed 9 almost 2 hours ago.
It's more serious cases. Putting it politely, it's not like you're on your deathbed, are you? So.
I'm on a bed.
You're on a bed, but you're not on your deathbed.
Hopefully it's a life bed. I'm hoping that the doctor's going to say that I'm fine and that nothing is the matter. I'm hoping that it's not going to be the smoking.
They'll probably tell you, probably lose a little weight as well, probably.
Yeah, if they tell me that, then that's fine.
That means you will have to cut down on at least some of the smoking.
Maybe.
Josh has found it difficult to give up smoking.
I've tried everything. I've tried cold turkey. I've tried the gum. I've tried the spray. I've tried the patches. I've tried e-cigarette. None of it worked.
But you didn't have the e-cig long because you ran out of the stuff, and then my dog thought it was a chewy and decides to bite it.
Yeah, she chewed the battery.
Thinking it was a chewy.
Killed the battery. Some people who say, "Oh, I'm going to give up smoking," don't exactly try. But I am one of the people that actually has tried. It's not an easy task to do. They tell me something I don't want to hear. I'm ready for it. I think worst case scenario in my head, I'm going to do cancer.
Or if you have a heart problem. So that's what you're here for, isn't it? To find out. I'll be safe and sorry.
As Josh is comfortable and not in a critical state, he will have to wait with A&E bed 9 until a doctor is free to treat him. Birmingham is home to the largest single-site hospital in the country. The Queen Elizabeth Hospital sees 1 million patients every year.
A couple of things that I need to hand over to you. We need to plan for 8 patients for those in the morning.
No, that's fine.
There is a little bit of a hiccup on the cardiology schedule because the lady that does it is not in today.
The hospital's dedicated day surgery unit treats around 25,000 of those patients. Day surgery bed 41 is with patient Anmarie. She has one of the world's rarest medical conditions, which causes problems with her blood vessels. In serious cases, it causes life-threatening internal bleeding.
What I've got is a rare syndrome called blue rubber bleb syndrome. I was actually born with it. Doctors didn't have a clue when I was born though, and I think it took them a while to come up with a name for it as well. So just in and out of hospital all the time. A lot of operations as well.
Anmarie is being looked after by Nurse De Castro.
You're going to have injection to your which knee? Left knee.
Husband Michael will also be by her side.
I don't know much about blue rubber gloves. What is it about?
We've got these.
Oh, right. So you got pimple that appears all over in your skin, is it?
Yeah, I've had them all in all various different places, and it's just like abnormal collection of blood vessels, and they bleed. I had them internally as well. I have had laser treatment on them, so some of them have gone.
Got something on your face and your lips as well, isn't it?
I've had one removed there and there.
I need to Google your,
yes.
your case. I haven't heard it before. Yeah.
Anmarie is one of only 200 people in the world diagnosed with this condition. She's had it since birth.
I used to end up having a lot of blood transfusions, and then I started having treatment where they would put a tube down and cauterise the ones that I would bleed in, but it just went on for years. And then I had my son, who haven't had a blood transfusion since I had him. So, and he's 24 now. But with my first pregnancy, I had a lot of blood transfusions. I had 24 units of blood. So that's how bad it was.
Anmarie has swelling in her joints and painful blue marks on her skin.
And Anmarie's had her condition since birth, in and out of hospital all her life with it. The way it impacts her usually is the little blue things she has, they're very painful. It's basically a big ball of veins which are sat inside the knee joints and everything, which are getting in the way and causing an awful lot of pain.
We've been married 30 years. Yeah, we've got 3 children. Well, they're adults now. And 2 grandchildren and 3 more on the way. Both my daughters are pregnant, due 3 days apart. So, and then my son has just announced that he's expecting with his girlfriend as well.
So we've got a busy 6 to 8 months sort of ahead of us at the moment, and probably a few more hospital trips in between. So it's going to be a bit hectic.
Is it okay? You ready?
Yeah. See ya.
So done.
See ya.
Today, Anmarie is having a new treatment on her knee.
I'll be good.
She will have a chemotherapy drug injected directly into the swollen blood vessels. This should shrink them and make walking less painful.
The risk of not having this particular treatment is it's just going to cause more and more pain, and it's going to be make mobility extremely difficult, if not impossible at some stage later on. It'll take a few treatments, but try and shrink it down to see if they can ease the pain on it and see if there's any further treatment they can do in the future once they've got past that stage then.
The doctor will use X-rays and ultrasound to locate the deformed blood vessels.
She tries not to have anaesthetic as possible, for the simple fact that she thinks if she doesn't, then she can get out a bit quicker and doesn't have to hang around as long.
Anmarie will stay with day surgery bed 41 throughout. Within 4 hours, she'll be back on the ward with husband Michael. The Great North Children's Hospital in Newcastle. More than 700 child healthcare experts and 246 beds are on standby to treat the children admitted here.
Can you squeeze my hands nice and tight? And this, oh, you'll end up breaking them.
The A&E department has 9 beds working 24 hours a day.
It's really looking more beautiful, aren't they?
Paediatric A&E bed 9 is with 12-year-old Patrick, who's hurt his back. Dr. Kamal will carry out his initial examination.
Hello,
Your mum, is it?
Yes,
What's
that's
your name,
right.
Mum? Sorry.
Andrea.
Andrea, and yourself, Patrick. What exactly happened?
I got tackled by one of the best tacklers in the school.
Right.
Playing rugby.
Right.
And
So that's an honour, isn't it?
yeah.
When he came home on Thursday evening, he was complaining of pain down his right side.
Right.
Patrick has suffered with back problems for the last 2 years. His mum Andrea is determined to get a diagnosis today.
I'm a little bit worried that perhaps there's an underlying reason for this backache, because he does get it quite regularly. So that is of some concern.
I usually have back problems once or twice a month. My back kind of swells up, like the muscles in my back, and I can't move, or I can barely move. And I usually just get a hot pack for that.
We left it over the weekend because we were thinking, well, maybe it will just go the way it has previously.
Yeah.
But by Monday morning, he was just in agony. So that was when I took him to the GP.
And then they sent him for X-ray.
Patrick had an X-ray at this hospital 2 days ago. The pain has since intensified, so his GP has sent him to A&E.
Are you able to walk normally as
I'm a bit like leaned forward, like an old man.
Are you able to run with the back pain or
no?
Not really at the minute. And are you able to show me where exactly the pain is?
Patrick really enjoys sport. Probably his gifts and talents lie elsewhere rather than in sporting activities.
It's down the centre of my back here and then to the right.
But they still do play a big part for him, probably more of an important social part of Patrick's life.
I'm going to run my finger down from the neck, all right? Let me know if there's any pain anywhere.
Oh, it's starting to cause a bit of pain down. No.
Not really, so can I get you to lie back on the back there? I'm just going to get you to lift up your arm.
Dr. Kamal has seen Patrick's earlier X-ray. His spine isn't fractured, but there are signs of another condition, scoliosis or curvature of the spine.
I'm going to recheck the X-ray again, and obviously there's a curvature on the X-ray.
Have you seen that?
Yeah, I've seen the X-ray. Just kind of generally, there's a condition what we call a scoliosis.
Yeah.
So
what's scoliosis?
It's that curvature on your spine.
It's just a curvature in your spine. I mean, if you look from front, it should be kind of, I mean, not should be, but the normal is kind of a straight line down from top to end.
This is like
yeah, and then in your case, I'll show you again the X-ray. So basically, it hasn't been formally reported, but most of the time it's an incidental finding. Really,
yeah, that's what I thought, that it was a coincidence.
Yeah, but I think it's just a muscular injury that will take some time to heal. But if you want to come around, and I'll show you the X-ray.
Okay.
Like, I mean, if you don't have any back pain throughout your life, you wouldn't find that out. Once I speak to the orthopedics, I'll get back to you and I speak.
Okay.
Around 4 children in every 1,000 in the UK develop this condition. It can be corrected by a brace or will right itself as the spine grows.
All right, okay, thank you. So I was right then, I'd already diagnosed that you had scoliosis.
I'm quite surprised because I just thought it would just be like a slight teeny curve, but instead it's actually quite a major turn to the right, and it just shocks me.
Patrick will need to be referred to a specialist for treatment.
It quite scares me, however, I might be limited to what I can do in the future from my back problems.
Hello.
Hello there.
So basically I spoke to the spine team on call, obviously and I did speak to the radiology on call as well. They just say it's just a scoliosis, there's no fracture that they can see. So what I'll do is I write a letter to the GP, be to refer to spine kind of team, then we take it from there really.
All right.
In the meantime, just regular painkillers, maybe rest for the next few days.
All right.
All right.
That's great.
Thank you very much. Take care.
Thank you very much. Thank you. Bye-bye. He's been told to maybe rest for a week or so and not be involved in contact sport for the next week or so. But really, you know, this should not stop him from carrying on in the future and doing what he enjoys.
Patrick's spine will now be closely monitored by the hospital.
Well, I think you need to stay off.
Specialists will decide how to treat his scoliosis if the curvature of his spine worsens.
Hi, Katrina. All right then, Patrick, you'll be hopping and skipping off that bed, won't you?
It doesn't look like I'm hopping and skipping off his bed.
Okay. Okay.
Newcastle's Royal Victoria Infirmary. Here, A&E bed 15 is with student George in an emergency monitoring bay.
Do you want to drink or anything?
Yeah, so have a glass of water.
Water.
Yeah.
There you go.
Student nurse Daly has been with him since he arrived with suspected meningitis.
He's come in with a rash on his foot, so we brought him in to monitor him straight away. We've done his bloods and done all the obs, so the doctors are just looking at the bloods now and getting results.
I'm worried, yeah. Having that rash, I think, was the main thing. Student, meningitis, maybe. Just being around everyone, isn't it? Even in a club, you're surrounded by 1,000 people plus. So I don't know.
Up to a quarter of students carry the bacteria that can cause meningitis, compared to 1 in 10 of the general population.
There's a jab which you're supposed to have, which, so if I wasn't quite sure I was going to uni until about a week after I got my results. So I sort of left it a bit last minute, and then obviously didn't get around to doing it, but it's sort of on the agenda to do.
George has been with A&E bed 15 for just over an hour. Registrar Dr. Vergoes arrives to assess his patient.
Is there any rash anywhere else?
Not that I'm aware of, no.
Have you not noticed something like this before? You haven't, right?
No, I didn't even notice that.
Fine. How's your appetite for food in the last few days?
Yeah, like I said, I've not eaten anything in the last few days.
George's heart rate is very fast, peaking at more than 140 beats per minute. An average heartbeat is around 80.
Who am I talking with?
Dr. Vergoes calls a specialist infectious diseases team for advice.
He's having high-grade fever and a heart rate of between 120 to 140. We need to rule out the reason for this petechial rash, just isolated only on both the feet. That doesn't essentially rule out meningitis kind of thing. Okay, thank you very much. Thank you. Bye.
The team advised Dr. Vergoes to get a clear diagnosis of meningitis through a lumbar puncture.
That involves taking fluid from your spinal canal. To be 100% safe, it is better to have a CT done before we do the LP, because if the brain is really swollen and we do LP, there's a remote chance brain matter can be pushed down through the spinal cord, and that's quite dangerous.
A&E Bed 9 will take George to radiology for a CT scan. Doctors are hoping they will soon have a diagnosis. Birmingham's Queen Elizabeth Hospital. Day surgery bed 41 is on its way back from theatre.
So how are you feeling now?
Alright.
You okay?
Yeah. Can I just scan your wristband? Is that right?
Anmarie's had a new procedure to alleviate pain in her knee. The pain is caused by a rare blood condition, blue rubber bleb syndrome.
I suppose your first question was, can I go online?
Yeah.
You've got your buzzer. If you need me, you just press that call button.
Thank you.
Anmarie should really use a stick or something, but doesn't want to do any of that. She just wants to get on with the battle through it and not let it get in her way, basically.
Anmarie must have 4 hours bed rest before she can leave.
I want to get out. That's the trouble.
You've got to wait until it's finished doing whatever it's doing.
Seriously.
After 4 hours with Anmarie, day surgery bed 41 is ready for its next patient.
Went a bit quicker than what I thought it was going to be.
Is that everything? Yeah.
I'm just glad it's done now. So just wait and see what the results are.
Well, thanks a lot,
Thank you
Cheers.
so much.
Thank
you. Bye.
Hopefully everything goes to plan and just wait till the next appointment then and come back and start again. We'll go the other side.
Anmarie will be back on the ward soon for another injection to help ease her knee pain. At Newcastle's RVI, A&E Bed 9 is with smoker Josh. He arrived with chest pains an hour and 20 minutes ago.
You've been watching too much Casualty.
Casualty? I haven't watched Casualty.
Or Poverty City, which one?
He's been seen by a doctor and is waiting to have an electrocardiogram, an ECG of his heart. He's also waiting for a chest X-ray. Josh's fiancée Emma is by his side.
Like she said, you haven't coughed up blood or anything, so...
Just want to go for the chest X-ray and the repeat heart tracing just to be sure.
Josh is given pain relief by Nurse Diaz.
Got some paracetamol and codeine in there. Going to do an ECG, is that alright?
The ECG will reveal how well Josh's heart is working.
And have you got one on your leg, darling? Just bend your leg and pop it in, that's it. You still got the pain now, is that?
It's starting to go away, which is good.
I don't know why they've done that. Alright, so nice and still for me. All done.
Thank you. I'll take these off.
The ECG shows his heart is working normally. After 2 3/4 hours in A&E, Josh separates from bed 9.
So I'll show you where it is.
And moves to radiology for his X-ray.
Push your shoulders forward. Relax there. And just hold your breath. Okay, you can breathe away. Okay, that's lovely. We're all finished.
Josh then goes back to A&E bed 9 to wait for his results.
Oh my god.
Yep.
When I went to go and get my chest x-ray, the doctor managed to pick something up. In my lungs there's a little bit of fluid.
Josh has a chest infection. He's prescribed antibiotics and painkillers.
He has to cut the fags.
I have to try and cut the cigarettes again. I will try to, but I'm not promising that I will.
3.5 hours after arriving, Josh leaves A&E bed 9 for another patient. He'll be back in 6 weeks for a follow-up X-ray. It will establish if the fluid is cleared from his lungs. In Birmingham's Queen Elizabeth Hospital, the day surgery unit has 81 busy beds. Today, Matron Ward is keeping every bed working to capacity.
Every day is a challenge, and I love a challenge. Over the last 10 years, day surgery has changed significantly from the removal of very small lumps and bumps using a trolley perhaps once a day and very small numbers of patients to a unit this size which has got 81 beds and procedures are now much more complex. So it means that procedures that 10 years ago required a 5-day length of stay, we can now do as a day case.
67-year-old Janet has arrived with her husband Raymond. Day surgery bed 32 will be staying with this seriously ill patient.
Getting a bit tired again. Okay, have a rest now again. Okay.
Janet needs to have a feeding tube inserted into her stomach as she's struggling to swallow.
Gets a bit too much, doesn't it? Right.
Nurse Draxelboer will look after Janet until her procedure.
Great. Hello. Well, my name's Kathy. Just to start with, I'll just check that we've got all your details correct.
Janet's throat stopped working properly following an operation to remove a tumour.
Yeah.
Professor Muhanna was the lead surgeon.
It was from just there all the way down to here. It extended all the way across there to here. So I would say it's probably about 12 centimeters by 10 centimeters, all that in her neck, basically. So
yeah.
It affected lots of nerves and arteries in her neck. We knew that she was going to lose the ability to swallow properly.
Janet and husband Raymond have been married for 38 years.
Didn't think when we got married we were doing this.
Yeah, we wouldn't have thought so, would we?
38 years.
Yeah. And 2 children as well.
Yeah.
Yeah. Son Ashley and daughter Hayley. Yeah. And 3 grandchildren. Just think, all in that time.
Yeah.
God, well, how time flies, doesn't it?
We've had some good times.
Yeah, we have had some good times.
I remember when Hayley was a ballet dancer in the dancing show.
She done the Doppler shows then, didn't she?
Yeah. Spent half our life
We did.
going to rehearsals.
Yeah, all them different
And
shows.
actually, we never stopped.
He never stopped. All that washing had to do.
Dad's taxi.
Yeah, Dad taxi was right.
That couple is just so caring.
Yeah, they're lovely. I think they've been married like 30 odd years.
Yes, that's what she said.
Yeah, he's so caring. He looks after us so much and well.
Yeah.
He reminds me of my husband though. We've been married 30 years.
Yeah, I've
so.
only been married 3 years and that's really encouraging, seeing them.
It was Janet's dentist who discovered the tumour during a routine checkup.
When I first went to the dentist, I found a lump in my mouth.
She did, didn't she? I only went for a checkup.
Yeah.
And she found that
Then they sent me here.
it was found out the 2 they taken out was a rare cancer, wasn't it?
Yeah.
It's a good job the dentist found it, really.
Yeah.
Yeah. God. She's my idol and she's my sunshine, and I couldn't do without her any time. When she comes out, that makes me perfect day. That is, rest of the year that will be.
Senior dietitian Forker specialises in helping patients who undergo this procedure.
Okay. She's having a tube inserted into her stomach so that we can provide nutrition support. It's a means of surviving because you need your nutrition for your treatment or just to live. So it's another option for a lot of people.
Doing really well.
It's 3 p.m. Day surgery bed 32 is taking Janet to theatre. It will stay with her as the feeding tube is inserted. Her husband Raymond will wait in the bay until she returns. In the emergency monitoring bay of Newcastle's RVI, 18-year-old student George is with A&E bed 15. George has symptoms of the potentially deadly infection, meningitis.
Meningitis can be serious if I go into the percentage of morbidity or mortality that can happen. Bacterial meningitis can be quite nasty, where the mortality, I don't know the exact figures, but it's definitely very high.
1 in 10 people with bacterial meningitis die from the infection. George's heart rate has soared and it's getting worse. He also has a rash. Both can be indicators of meningitis.
Heart rate can be influenced by a lot of physiology that's happening in the body. So mainly temperature can increase the heart rate, but not up to this rate, which is like going at 120 to 130.
George is taken on A&E bed 15 for a scan of his brain.
The difficulty in diagnosing meningitis is most of the time it won't have a picture to start with, and then it will progress on to give us a full picture. So we never wait to have complete diagnosis before we start treatment. We presume and we start treatment at the earliest, so that can reduce the morbidity or the mortality.
Back on the ward following treatment, George's condition begins to stabilise.
Heart rate has come down pretty nicely. So the heart rate was due to the fever and the dehydration. It's quite clear from the history that he's not been eating and drinking for a couple of days. So that, coupled with his rise in temperature and having an underlying infection, is the reason for the high heart rate. The full picture won't be available in the initial presentation, so definitely he needs to be admitted and observed.
George will leave A&E bed 15 for an overnight bed on a ward. A&E bed 15 now faces a thorough clean before it meets its next patient.
Get another drink.
Back in Birmingham, 67-year-old Janet is with day surgery bed 32. She's struggled to eat since having throat surgery. Today, she's having a feeding tube inserted into her stomach.
I know, and I'll give you some medicine just to sedate you. You will not knock out. It's not a general anaesthetic. It just makes you a little bit sleepy.
A tumour was discovered in Janet's throat a week before her 38th wedding anniversary. Husband Raymond was working at the time.
I got my job in, I did. I just wanted to look after my wife. I can't do enough for her. Whatever she wants, she can, she get it off me. That's the main priority.
Are you okay? I'm going to be finished. I'm halfway through. Just bear with us, breathe. Absolutely fine.
If I lost her, anything happened then or before, be demonstrated. Yeah, that's it.
Okay, it's all over. Oh, you're very brave. I'm sorry, that was really not nice for you, was it?
Day surgery bed 32 is with Janet in the operating theatre. The procedure takes less than half an hour. Bed 32 then transports Janet back to her husband Raymond.
We'll move that.
Okay. Yeah. Okay. That's right. Yes, yeah. Hey. Yeah, fine. I was like what I always say. My sunshine now. Get on the men now. I know. Back on the wall now. I know. Yeah. And it won't be long before you go home then. Tomorrow. Yeah.
It will take time for life to get back to normal. Senior dietitian Forker has to prepare Janet and Raymond for what lies ahead.
Janet's husband's going to have to do a lot. We're going to have to show him tomorrow and Friday how to use this feeding tube, how to take care of it, and probably discuss changes because every day is going to be different. Janet will have to watch and make sure there's no risks of infection because it's a tube that's inserted into your stomach. She'll have to make sure there's no infection. She'll have to make sure that they insert the tube and move it around and pull it back out because your body's normal reaction is to heal.
Right. I'll see you tomorrow, okay? Okay? Okay. Yeah, I'll tell Lady as well. Go home, do the cats, and then I've got to fill my stomach up for a bit of hands and this all day. We'll just come back up tomorrow morning and hopefully take her home then, hopefully.
Our hospital beds have given us intimate access to the work of the NHS. Antibiotics cleared up Josh's chest infection, but he's not yet managed to give up smoking. Tests revealed student George had influenza A and bacterial tonsillitis. He's now back enjoying student life. Janet's feeding tube is helping her to take on board vital nutrients she needs to aid her recovery. Patrick was referred for physiotherapy. Scans of his spine have shown the curvature has started to straighten. The beds are now back on their wards, ready and waiting for their next round of patients.